We're going to go through, this is an educational event. My name is Scott Teagle. I'm a licensed insurance agent since 1982, which dates me somewhat, but I focus strictly on Medicare products, and I conduct these workshops in a number of libraries around the Dallas area, including Carrollton. In fact, I have another one going on Saturday with the Louisville Library at the same time, 11 o'clock in the morning. And so this has gotten a lot of reception from the libraries, very positive. We do a great job in informing everyone about Medicare. So with that, we're going to get started. You'll see my contact information down here. So if after the presentation you'd like to reach out to me, you've got my phone number, email address, and so with that, we will get started here. So the first thing we're going to cover are the enrollment periods. And the initial enrollment period is when you turn 65. And it's a 7-month window. Starts 3 months before your birth month and ends 3 months after your birth month. So if you are 65 years old, you are not on an employer group health plan, then you're going to want to enroll in this enrollment period. Also, people that are on a employer group health plan where it's a small employer under 20 employees, they're going to want to enroll in the initial enrollment period also. If you don't enroll during this enrollment period, you will probably be paying a late enrollment penalty. Again, this is for people who are not on a large group employer health plan to enroll, or if you're on a small group enrollment group health plan. The next one is the special enrollment period. This is for people who are, again, on a large employer group health plan, and they continue to work, and they're older than 65, and now they're ready to separate from their employer and their employer coverage and enroll in Medicare. So they would use the special enrollment period for that. I know it says 8-month window that you have to enroll in that, but most people want to dovetail their ending of their group health benefits with the start of Medicare. And so although there's that enrollment window there, most people are trying to dovetail it. The COBRA, retiree health plans, veterans benefits, individual health coverage under the ACA coverage, these do not apply towards the special enrollment period. So if you're staying on COBRA and you've separated from that employer, you're going to want to enroll in Medicare very quickly, because COBRA, all these plans are secondary to Medicare when you turn 65. So if you're older than 65 and you're going to be enrolling under that special enrollment period, COBRA, for example, is secondary to Medicare. So if you're filing under COBRA, some health claims, they may come back and say, hey, we're secondary. You're going to have to pick those up if you didn't have Medicare. So now, if you're on a high deductible health plan with a HSA, health savings account, then you don't want to enroll in Part A when you turn 65. Part A is what you've been paying into for your working career. That's that little amount that's deducted out of the paycheck. And that basically is going into your Part A coverage, which is your hospital coverage under Medicare. And some people will enroll in Part A because it's all paid up when they turn 65, and they'll enroll in Part A and hold off on Part B. Now, if you do that, be sure not to have a high deductible plan with an HSA, because you can't have both at the same time. It's a conflict with the IRS, and they will be reaching out to you, about that. When you're older than 65, Part A actually will start earlier than your enrollment date. And so it doesn't start any earlier than 65, but let's say you stayed didn't enroll in Medicare and you're 67 now and you're enrolling in Part A, it'll actually start 6 months earlier. Don't ask me why it is, but that's just the way it is. So it would start actually at 66 and a half if you enrolled at 67. You're going to need paperwork also if you're enrolling under the special enrollment period. The 40B and L564. There's paperwork that will need to be submitted to Social Security when you enroll under the special enrollment period, so you will not have to pay a late enrollment penalty. It basically validates that you had group coverage because part of it's going to be filled out by your employer. And then that's under the L564 form. And then the 40B basically tells Medicare when you want your Part B to start. The last enrollment period is the general enrollment period. And you enroll in that January 1 to March 31st. And coverage starts July 1. So unlike the initial enrollment period and special enrollment period, where you can designate when you want your Medicare benefits to start, the general enrollment period is you can only enroll in the first quarter of the year, and it starts July 1 period. And so, and you're probably going to pay a late enrollment penalty if you're enrolling under the general enrollment period. So, so anyway, those are the 3 enrollment periods for Medicare. Any questions?
So I take it that after every year, once you've signed up initially for Medicare, every January you have to enroll again?
No, you only enroll once.
Oh, okay.
No, the general enrollment period is for people that did not enroll in the initial enrollment period or the special enrollment period. And so the only thing left to them is the general enrollment period. And they're limited to enrolling in the first quarter of the year, and their benefits start July 1. But you only enroll in Medicare once.
Okay.
Well, I take that back. You may enroll twice, because if you're enrolling just in Part A, then you need to enroll again for Part B. So, normally most people, like I said, are enrolling at 65 if they're not covered under employer health plan. Or a spouse's employer health plan. And then they would enroll under the special enrollment period if you have large group coverage when you turn 65. So I've had people that were under COBRA, and they stayed on COBRA for 18 months because they had a younger spouse and they didn't want to leave them with no coverage, didn't want to go on the ACA plans. Well, they missed the special enrollment period because they stayed on COBRA for 18 months. And then when that ran out, the only thing left to them was the general enrollment period. And there probably was a gap in their coverage. And so that's the way it is. So a lot of people, it's very important to understand these enrollment periods and work with somebody that is familiar with Medicare, because there are a lot of nuances. Okay, anything else?
We don't currently have any questions in the chat, so I think we're doing good.
Good, okay. Well, we'll move on here to how do you enroll in Medicare? Well, the easiest way is to go to ssa.gov. And in there, once you go to ssa.gov, there's a picture it says Medicare, and you would click on that and then go down the page. And depending on which enrollment period you're enrolling under would determine where you click on the page. But that's the easiest way to do it. All the Social Security offices are closed now, so it's the only way to do it. And once they open again, you can go down there, but no sign of that happening anytime soon. Okay, the only time you will be automatically enrolled in Part A and B is if you're receiving your Social Security income benefits when you turn 65. Again, you can start taking Social Security income when you're 62, So if you are receiving Social Security income when you turn 65, or if you're started up later and you haven't enrolled in Medicare, you will automatically be enrolled in Medicare unless you let them know that you don't want to start your Medicare benefits. So that's the only time that you have automatic enrollment. Okay, Part A. It's commonly called premium free, and you are qualified for it if you're receiving retirement benefits from Social Security. The eligibility for Part A is that you earned 40 credits, and that is that you've contributed into Medicare for 10 years. A credit is 3 months of contribution. So that's 10 years of contribution into Medicare, and you're eligible for premium free without a premium. You've already basically paid up. If you're receiving railroad retirement benefits, you're also eligible for Part A premium free. Your spouse would qualify if the spouse is not earned the 40 credits once the qualifying spouse is enrolled in Part A. So if the older spouse is the one that fully qualified, then when the younger spouse turns 65, they would enroll in Part A and have it premium free. If it's the other way around and the older spouse is the one that did not qualify, well, they're going to pay a premium on Part A until the younger spouse enrolls. So that's a little nuance there. Also, federal, state, local employees may be eligible. Prior to these dates, we had civil service. And some people chose to stay with civil service and not go into Social Security. All right, this is the premium for Part A if you did not qualify with the 40 credits. So in 2021, if you had less than 30 quarters, your premium is $471 a month. 30 to 39 quarters is $259 a month. And so that's the premium today. So that spouse that did not earn the 40 credits, if they're having to pay their premium, this is the premium they'd have to pay for Part A. And Part A has a late enrollment penalty if you're not enrolling in a timely fashion. This penalty does not apply to people that have full credit. In other words, the 40 credits. It just applies to people who would be paying a premium that did not enroll in a timely fashion. And that premium is 10% of that 471 or 259 for double the amount of time that they did not enroll and should have enrolled. So if you are late for 2 years, you're going to pay that penalty for 4 years. This is the only penalty that drops off. All the other ones stay with you as long as you're on Medicare. Okay, so what is Part A? Well, it's your hospital benefit. 100% coverage on a semi-private room for the first 60 days after you've paid a recurring deductible of $1,484. And that recurring deductible comes into play if you had more than 60 days between day of discharge and admission into the hospital again. If it's less than the 60-day window, you don't have to pay that deductible a second time. Then if you're in the hospital 61 through 90 days, you're going to pay a coinsurance payment of $371 a day. And then you have 60 lifetime reserve days. You only get those once, so you use those, they're gone, and you're paying $742 a day for those 60 lifetime reserve days. So what we're looking at here is a continuous hospital stay of 150 days. That just doesn't happen today. Keep in mind this was designed back in the mid-60s, and hospital stays were a lot longer. So today's world, what ends up happening is you go out of the hospital, and if you're not ready to go home, you are going to a skilled nursing facility. And so they get you in and out of there pretty quick. Very surprising if you're there more than a couple weeks actually in the hospital. So if you need to recuperate, you're going to skilled nursing, and the qualification for Medicare to pay for skilled nursing is that you have to be an inpatient for 3 days and within 30 days of discharge. The day of admission counts as a day, but your day of discharge does not count as a day. And so Medicare will pay 100% of skilled nursing facility costs for the first 20 days. Day 21 through 100, $185.50 is your daily premium rate for staying in skilled nursing. In hospital or freestanding psychiatric hospital, you have 190 days lifetime benefit. Hospice and home health services are also covered under Part A. So hospice is when you're terminally ill, been certified that you have 6 months or less time to live, and hospice comes in mostly to provide pain medication. Make sure that your transition is as easy as possible. Home health services are when you're doctor certified again and you're homebound. And so you're requiring some medical attention. It has to be through a Medicare certified home health agency. And that's basically to provide physical therapy or medications if you're homebound. It's not to feed you, clothe you, bathe you. That's long-term care insurance. That is not covered under Medicare. Part B. Part B is income-based. Standard premium is $148.50 a month. And what happens when you enroll in Part B, and every year Social Security reaches out to IRS to get some information off your latest filed tax return, which what they're looking for is your modified adjusted gross income. What is it? Or MAGI. And if it's income that is above these threshold levels, you're going to pay an IRMA charge, income related monthly income adjustment amount. So the threshold for a couple filing joint is $176,000, single $88,000. And so you'll be paying a premium for your Part B. And now you can appeal that. So if you have there are certain life-changing events that might cause you to have appeal accepted by Social Security. One of those, for example, let's say you've retired, and so now your income has dropped drastically because you're not working anymore, or maybe you took out a bunch of money out of an IRA or something back before you retired, and so it bumped your income up. So certain events, or you had a spouse die, an income-producing spouse that died. Maybe you went to part-time as opposed to full-time. So again, your income is greatly reduced. So there's certain life-changing events that you will qualify for an appeal. Okay, the Part B has an annual deductible of $203. And it's 80-20 coinsurance. So Medicare pays 80% of any Medicare approved expense under Part B, which is basically your outpatient coverage. And you pay 20%, and that 20% is unlimited. And that may not sound like a lot, but if you go in the hospital and you have surgery, that doctor charges for that surgery fall under Part B. And so 20% might be $30,000 of the doctor bill. Could be substantial. There is a late enrollment penalty also for Part B. Again, this would apply to people that had no group coverage and they enrolled late, or they worked for a small employer under 20 employees. And so late enrollment penalty for Part B is 10% of the premium for every 12-month increment you didn't enroll and should have enrolled, and it never goes away. You're going to pay that as long as you have Part B. Okay, so what does Part B cover? Like I said, it's basically your outpatient coverage, medically necessary items, preventative items like physicals, wellness exams, in-hospital doctor charges fall under Part B. That's a big one right there. If you don't have something to control the cost of that 20%. So doctor office visits, ambulance services, shots, flu, pneumonia, hepatitis B are fall under Part B. Shingle shot falls under Part D, which is your drug coverage and with Medicare. Screenings, durable medical equipment, second opinions prior to surgery, they all fall under Part B. If you have any questions, just feel free to speak up at any time.
Vivian just sent in a question. I don't know if you can see it, Scott. She said, do you pay the premium even when you get health benefits from the large company you retired from?
Say that again.
Do you pay the premium even when you get health benefits from the large company you retired from?
Yeah, well, retiree benefits are not, like I said, they're secondary to Medicare. So retiree health plans, although they may be offering something, you still should be enrolling in Medicare. Most of them require you to enroll in Medicare if you're on a retiree benefit plan. Yeah, if you don't, then because teachers' retirement requires you to enroll in Medicare to have teacher retirement benefits. Most large corporations, if they have a retiree health benefit, they require you to enroll in Medicare also.
Okay. Does that make sense, Vivian? Okay, she said yes. Thanks.
Okay. So Part A and B are government provided benefits. Part C and D are provided by insurance companies. And so now we're going to look at your health choices under Medicare, generally speaking. And so option one is you have original Medicare, which is your Part A and B, and you can add to that a drug card and a Medicare Supplement. Or you can opt out of original Medicare and go into a Medicare Advantage health plan, which are HMOs and PPOs, and they typically include the drug coverage also, Part D. And so here the coverage is comparable to original Medicare, but you're dealing with networks of doctors and hospitals under Medicare Advantage. So let's go into kind of some of the differences between the two options. With a Medigap supplement policy and drug card, you're going to be paying a higher premium typically than if you're on a Medicare Advantage plan. But you can go to any doctor that takes Medicare. There are no networks. So virtually all hospitals take original Medicare, and most doctors take original Medicare. And it's good anywhere in the U.S. So if you're traveling or move, you can carry your plan with you. If you have a serious health condition, and let's say you want to go to MD Anderson in Houston, you got a certain kind of cancer and that's the best place for you to go, and you want to go with that surgeon down there, you can do that under a supplement. Can't do that under an HMO or PPO Medicare Advantage plan. And so Medicare Advantage plans have very low premium. A lot of them at zero premium. You don't pay anything beyond the Part B premium you're paying already. And so what they do have is co-pays. So you pay co-pays to doctors and hospitals for different services that are rendered. And it's maybe zero copay to your primary care physician, $25 to go to a specialist that's in network. If you're on a PPO and it's out of network, you may pay 40% of that cost. Hospitals the same way. Certain hospitals are in network, and then you have maximum out of pockets on these HMOs and PPOs. Maximum out of pocket on an HMO in Dallas right now is around $4,000 per year. PPO is $10,000 to $11,000 in and out of network. And so you're paying on the back end on the Medicare Advantage. You have a very low premium, but you're limited in your flexibility of where you can go to get medical care, and you pay higher out-of-pocket expenses. On the Medicare Supplement, again, you're paying higher premium, but you have flexibility to go to any doctor, and you have very little out-of-pocket expenses. So, for example, under the Medicare Supplement, these are standard Medicare Supplement plans. The most popular plan today is Plan G, right there, and you can see why. Pays 100% all the way down, except for this little box here, which is your Part B deductible, which is $203 this year. And so you pay the $203, and then after that, between Part A and B and your supplement, it pays 100% of everything else of a Medicare approved expense. So that's the so there are other plans there. Plan N, for example, is you're paying, again, it pays 100%, except for, you can see the little number 3 here. You pay a copay to go to the doctor in emergency room. $20 to go to the doctor, $50 for the emergency room. That's noted down here. And and then you also are paying the Part B deductible. You also will pay what is called excess charges. If you're getting treatment from a doctor that does not agree to Medicare assignment, in other words, they agree to bill for what Medicare allows, then you're going to pay 15% above what Medicare allows. Now, most people, they're going to doctors that accept Medicare assignment. So that's not really a huge issue. But if you end up going to one that doesn't, then you're probably going to end up paying 15% above what Medicare allows. The plans off on the right here, which are kind of blocked by my little thing there, is Plan C, F, and high deductible F. These are no longer available to new enrollees into Medicare. At the end of 2020 or 2019, they were not people that enrolled in Medicare before 2020 can still get those plans if they're available from the insurance carrier, but they're not available to new enrollees. Now, Medicare supplements are all standardized, and so Plan G with one carrier versus another carrier is going to be the same. So the only difference is, what are you paying for it? Who has the best premium rate? That's the only difference. They're standardized by the federal government, so there is no variation between any of these plans with any carrier that might offer them. Okay, so Medicare Advantage. Who can join those? Well, you have to live in the plan service area. That's your zip code, your residential zip code. You have to be a U.S. citizen, U.S. national, or lawfully present in the U.S. You have to have Part A and B, and these are the types of Medicare Advantage plans, which are your HMOs and PPOs, private fee for service, special needs, HMO POS, and medical savings accounts. So HMO is, you got a network of doctors and hospitals. There are no benefits out of network. You have to go to in-network providers only for them to pay. PPO, you can go out of network, but again, you're probably paying 40% of the cost to go to an out-of-network provider. Private fee for service is a plan that has a network, but you can go to let's say your doctor may not be in network, but if he agrees to the terms of the plan, you can go see him and get an in-network benefit. But he can leave anytime he wants to if he doesn't like it. Special need plans are for people with chronic conditions. It might be diabetes or heart problems. Hmo Point of Service is defined as an HMO you can go out of network on. The medical savings account is very similar to an HSA with a high deductible health plan. There's a savings portion that is funded by the government, and then you have a deductible that's higher than what they're contributing to the savings account. So there's a gap there, and there's no networks. But just like the private fee for service, the physician has to agree to the terms of the plan. Okay, so Medicare Advantage plans have enrollment periods. So you can join in your initial or special enrollment period or the general enrollment period. Again, the benefit wouldn't start until July 1. And you had to enroll in January through March. Annual enrollment, which is basically October 15th to December 7th. This is where people that are on drug cards or Medicare Advantage health plans, they're deciding what plan they want to be on for the coming year. And the benefit goes into effect January 1. The open enrollment period is going on right now, and this is for people who signed up for a Medicare Advantage health plan, and they have one choice to make a change. They can go back to original Medicare, or they can change to a different Medicare Advantage health plan because maybe the one they enrolled in back in the annual enrollment is not the best one suited for them. For whatever reason, they don't like it. Maybe they found their doctor isn't in network anymore or something, and they want to change. So you have one opportunity to make that change. This only applies to people on Medicare Advantage health plans, not just drug cards. Special enrollment periods. You move from one zip code to another. Can be within the state, could be out of state. That creates a special enrollment period for you. You lose credible drug coverage. This is someone who's on a group health plan, but they get a letter from their insurer that their coverage for drugs is not credible any longer. And so they have to enroll in Part D or pay a late enrollment penalty because they've had a gap in coverage. Medicaid, extra help, and nursing home, those three categories have quarterly enrollment periods. So once a quarter, they can change if they want to. What else should you know about these plans? Well, they have extra benefits that are beyond original Medicare. We'll touch on that a little bit. Vision. You can get a vision exam under original Medicare, and that's covered, but they don't pay towards glasses. Dental coverage is not covered under original Medicare. A lot of the Medicare Advantage plans have a dental coverage. Most of them, you have a network of dentists you have to go to, but they're fairly broad, some of them. Hearing, Medicare will only pay original Medicare, if you have loss of hearing or tinnitus, and they do not cover hearing aids. Original Medicare Advantage plans, you don't have that criteria for getting a hearing exam, and they may contribute something towards hearing aids. Fitness, silver sneakers, that's well advertised. Most people are familiar with it. You can join multiple gyms, go work out, and there's no extra cost. It's part of the program. You have copays and maximum out of pockets under Medicare Advantage plans. We've already touched on that. Most include drug coverage. The ones that don't are for people that typically get their medications from the VA. You must follow the plan rules, and providers can join or leave networks at any time. Out of area service. Now, these Medicare Advantage plans, they have a service area. And in Dallas, it's typically Dallas County and the surrounding counties. Any farther out than that, it's emergency care only. So if you're traveling a lot, you're only going to be able to get care if it's an emergency. So this is an important thing to keep in mind. You can check your coverage also and cost prior to service being rendered. So if your doctor is recommending you have a surgery of some type, you can check with your plan, see, okay, what are my out-of-pocket expenses going to be? You know, is this covered under the program, etc. And you have a right to appeal as well. Part D, this is the last segment of our presentation on drug coverage. These are the standalone drug plans. Although most of the criteria does apply to drug coverage under Medicare Advantage plans also. The difference is that with Medicare Supplement, you can choose the Medicare drug plan that is most advantageous to you, both from a premium standpoint and drug cost standpoint. Medicare Advantage, you're tied to the drug plan that goes with that health plan. So you don't have any options as far as choices there. It is what it is. And when I'm working with a client on Medicare and they're interested in Medicare Advantage, we're looking at what their drug cost is going to be, as well as are their doctors in network. And so those are the two primary criteria we're looking at first to determine what is the most beneficial plan for them. Okay, drug plan is optional, although if you don't take it, you're going to pay a late enrollment penalty if you enroll later. It's also IRMAA rated, so if you're a high income wage earner, you will pay an extra charge for drug coverage. Late enrollment penalty is applied if you're without drug coverage for more than 63 days. And the late enrollment penalty is the average cost of pharmaceuticals for every month that you're not enrolled in drug coverage, and you should be. So over a year, if you weren't enrolled for a year, it's going to average about $4 to $5 a month penalty, and for every 12-month increment. And that doesn't go away either. As long as you have drug coverage, that you'll be paying that penalty. Employer and union coverage, we kind of touched on. If you're received a letter, your drug coverage is incredible, check with your employer and union before you decide to go on a Medicare Part D drug plan, because they may kick you off the health plan too. So that's important to check with HR. Some of the vaccinations, shingles, DTaP, chickenpox, hepatitis A may be covered under your Part D drug plan. The drug coverage has enrollment periods also. They pretty much mirror up with the Medicare Advantage health plans, except I need to remove this. The open enrollment doesn't apply for making changes under drug card. So they're very similar to the enrollment periods for Medicare health plans. Okay, so there's 3 different stages in the drug coverage. The first of the year, when you first enroll in Medicare, you have the initial phase. And that initial phase, you're paying a copay and deductible. Your deductible maximum for 2021 is $445. Not all the plans have that deductible, but most do. And so you're paying a copay and deductible, and your plan pays a part of your drug cost also. So it's a shared expense. When your drug cost reaches $4,130, and that's what you paid and what the drug plan paid, then you're going into the donut hole and or coverage gap. And so that's and at that point you'll pay 25% for brand name and generic drugs. Now, on medications, all these plans have some criteria that may apply. Some of the medications that you have may require prior authorization from the plan. Others may have step therapy. In other words, there's multiple drugs that can be used for a particular condition, and instead of giving you the most expensive one, they're going to start out with the least expensive one, or one that's less expensive. Now, part of that depends on your history. Then also their quantity limits do apply. This is particularly on opioids. Okay, when your true out-of-pocket expense, or TROOP, reaches $6,550 in 2021, then you exit the coverage gap or donut hole and you go into catastrophic coverage. Your TROOP does not include your monthly premiums or non-formulary purchases. So if you're buying your meds or some of your meds from, let's say, GoodRx or Canadian Pharmacy, they're not going to be included in your true out-of-pocket expenses. So what is included in that? Well, your annual deductible, co-payments that you've made, co-insurance you've paid, the added out-of-pocket costs for drugs while you're in the coverage gap. And then when those add up to that $6,100, you go into catastrophic coverage, and there you're paying the greater 5% of the cost of your medications, or the copay of $370 for generic, $9.20 for brand name. That concludes our presentation. My contact information again is here, phone number, email address. So if you have questions that crop up afterwards, or you want some assistance in guidance on Medicare options, be glad to assist. There's no charge for that. I'm compensated by the insurance companies if you choose to use me to assist you in obtaining your coverage. So, any other questions?
Not seeing any yet. I'll give just a minute to see if anything comes up in chat.
Okay.
Thank you for that presentation, Scott. That was excellent.
Well, great. I appreciate being able to do this with the Carrollton Library, and we, you know, it tries to be very comprehensive. I'm not allowed to go into company-specific type stuff, but generally speaking, this is, like I said, an educational event, so it's just going into the dynamics of Medicare. And anyway.
Well, our attendee has said no questions and thanks for the presentation. So I think
We're
good to
done.
wrap up.
We're done. Yeah. Thanks, Scott.
Okay, Tina. Well, we'll have to do this again, and I'll get back in touch with you via email on that.
You bet.
And so thank you so much for hosting today. It's much appreciated.
Thanks
And
for-
you'll have a great week.
You
Thank
too.
You too. Bye, everyone.